Hey, it's Dr. Dan Purser, danpursermd.com. We're going live now. We're going to talk about fertility and miscarriages and pregnancy. That's what we're going to discuss tonight. I know it's hard to cover all that in a little over an hour, but let's see what we can get going here. Thanks for everyone being here. I know you're all dying to find out what's going on with all this. I did make a mistake earlier in the week. I said toxemia. I'm not going to discuss toxemia tonight. It's not tied into MTHFR. I am so sorry. So you can log off now if you're here just for that. But if you're here for preeclampsia, eclampsia, ED, men's ED, obviously, low libido, infertility issues for women and men, that's what we're going to talk about. Some natural options that can really help with those problems. So, a couple of things. So we have sales going on physiciandesigned.com. Is it on my website too, danpursermd.com?
It connects.
Oh, how's that magically appearing? Oh, it's like a hand read sale.
Magic.
So this is MTHFR support. It's a buy one, get one free. $20 a bottle. Are you kidding me? How?
Don't ask.
You're going to
Don't
bankrupt
look at me that way.
Okay. So get those now while they're still on sale. It's for Valentine's. And this is, wow, another thing appeared. This is our foundation methylation genetic kit. You just swab your cheek 30 seconds each side, put it in the tube, put it in the mailer, and send it. Now, the tube will have your name written on it. We have to do that. For those of you who are like, oh, I don't know if it's sterile or this and that. No, the tube has not been opened. You can tell it's still sealed. But it's going to have your name written on it and some other information we have to apply on there. So don't complain when it comes opened, the little tube, and your name is written on it magically.
The tube's not opened, but
right,
the box is opened.
Yeah, the box.
But don't worry, it's just me. It's just me writing it.
Yeah, exactly. So anyway, this is what it looks like. Super easy, little swab inside of each cheek, 30 seconds. Okay, that was easy. 10 days later after you mail it, maybe 11 or 12, how long the mail takes, but we will get your results back. Woohoo. Then we can talk. So, reminder to follow me on Facebook Lives and video. They'll all be captioned. Are they captioned?
No.
Oh, sorry. I didn't say that. But podcast chats with Dr. Purser on Facebook, Twitter, Instagram. And make sure you check out Pinterest. My pin or picture collection is amazing. And sign up on our email on Physician Designed and my danpursermd.com email. Make sure you're on those lists. Because we'll notify you of sales and stuff like that. Buy one, get one free sale. Don't forget, I am coming out soon with a genetics test for dementia. That'll be very reasonably priced, easy to do. It'll be in that box. So swab each cheek 30 seconds, send it off, and then you'll know. And I can tell you what the studies have shown. I'll even put my May talk, my May PowerPoint with me going through it, on Facebook as a video, and it'll be on my YouTube channel. So make sure you check out my YouTube channel. Also, in Fibromyalgia with Natural Options, the Facebook fan page. Make sure you check that out if you have fibro or you have a friend who does. It is truly amazing because it shows them all kinds of free options to get better. Yeah, isn't that crazy? Low copper diet. It's not fun, but it's amazing. So
it's kind of fun.
It's whatever. Okay. That's Breckin who chatters at me. She's really annoying.
Thank you.
So
that's in my job description. Annoying.
Yeah, it was annoying stepdaughter. Okay, DHL. We do ship to Australia and Canada and Europe. Do we ship to Africa?
Yeah, we are set up worldwide.
Mm-hmm.
So we can ship to China, but they won't ship back to us, right?
For the time being, yes.
Yeah, it's probably better that way. Okay, so all channels are now open to all around the world.
Except for testing. Testing is kind of tricky.
Yeah, testing is tricky. If you can get it back to the U.S. in less than 3 weeks, the genetic testing, it'll work. Mm-hmm. But if you can't, it's because it's got to get to Austin, Texas 3 weeks after you swab. 3 weeks. So, okay. So, for any of you who want to see me or want to be patients, I am 45 minutes south of the airport in Salt Lake City on a good day. So, and you can be scheduled by going to danpursermd.com schedule me under appointments, right?
Yeah, and also you can book an appointment with him via phone and go to meeting,
Yeah,
which
the
is
phone
virtual.
is 801-796-7667. Okay,
Yep.
so let's get to this because I know you guys like me to not chatter too much and just get to it. So, so what do you think the number one cause of loss of libido for females I see in my practice? What do you think it is?
My guess is low progesterone. No,
What?
Libido would be testosterone. No?
That's not a cause.
Oh, cause.
So what's that's just another finding.
Symptom?
That's a sign, actually.
Okay.
So signs are what you...
Yeah, explain this.
A symptom is what the patient complains of. They're not going to come in and go, I feel like my testosterone's low. I feel horrible. They don't know that.
That's
It could be
true.
high, and they could be saying that. So they're saying, I don't have libido. I'm not attracted to anything. I just want to go home and be a stump. Watch cartoons with my kids or whatever.
Yeah.
So that's a symptom, low libido. A sign is low testosterone. That's when the doctor picks it up on lab.
Okay.
So what do you think the number one cause of low libido or loss of libido in females that I see in my practice? What do you think the number one thing I see?
Is it a common one that you always see? Is it MTHFR?
That's a really, really root cause
Okay.
for a lot of them. But yeah, it's vitamin deficiencies.
Of course.
It's by far and away the number one cause. Next would be ovarian damage or pituitary dysfunction. And that gets a little hairier, a lot. And you just got to go with HRT and some other things at that point. But not always. So the number one cause of infertility for females that I see...
Vitamin deficiency.
Oh, you got it.
Is there specific ones, or does it kind of depend on the case?
Probably the most common I see is B12, folate, pantothenate, serine, amino acid, really not a vitamin, zinc. Those are about the top 4 or 5.
Interesting.
Maybe a D3 deficiency. So now the hard question: what causes these vitamin deficiencies? Think of the music playing from what's that show?
Jeopardy.
I love that show.
Did I hit it earlier with the root cause?
Well, you tell me.
Is it genetics?
Take a guess. I'm not going to get. Oh, you said
genetics. I went with the big over the head.
Yeah, among young living distributors, and people follow me. It's almost always MTHFR or some other methylation problem. They have it. Some of them have it bad.
Yeah.
I mean, like the worst I've ever seen. So,
Yeah.
Yeah. So, I just brushed the mic. Was that bad?
You're good.
It was just pins and needles in their ears.
Yeah, it scares me. So, what do you think the number one cause of infertility for males I see in my practice?
I'm going to guess again. Oh, cause
of infertility in males.
Is it vitamin deficiencies again?
It is. How did you know that?
I've been listening, I think, today.
So
far.
Okay, now you should easily get this one. What's the number one cause of loss of libido for males I see in my practice, and most doctors see?
Vitamin deficiencies.
You're wrong. It's stress.
Is that a cause?
Yeah.
I guess, stress is a cause. I was going to say
you blew
depression.
that completely. I handed it to you and you blew it. So you should have got his stress, not vitamin. What?
Hey,
No.
every other answer that has been the answer, every other question.
You got sucked right into that one.
I
didn't you?
did.
That's how they get you in medical
You're
school.
tricky.
Too. Okay, so what is the number one major cause of stress I see in my practice in men? Number one cause of stress. Think about it. Easy, super easy.
Life.
I don't know about what? Life?
Number one cause of stress.
Life's too general.
Okay.
Got to be more specific. We're running out of time. These people are waiting
Money,
for an answer.
Kids, family,
Job. Work is the number one cause of stress I see.
Makes sense.
In men. So what is number 2? You kind of vaguely said it with that money answer.
Money.
Bills.
Finances.
Finances, yeah. So what's number 3? You're right on track.
Family.
Wives.
You can't say that. No, I'm just
Well,
kidding. What's a wife's
you.
number one stress? Husbands. Just
No.
kidding. My husband just walked in the door right when I said that. I could not have been a better time.
Smile on his face right now.
Yeah, 100,000 people will hear this
Yeah.
now. So.
Thanks.
What's the number one cause of erectile dysfunction or ED I see in my practice?
Is it a trick question?
No.
Is it vitamin deficiencies?
No. No, it's the most obvious answer in the world.
Low testosterone?
Low testosterone is the number one cause of ED I see in my
I thought
practice.
that was a sign.
I'm amazed how many guys are given Viagra or Cialis or something like that. Makes me so mad. And I'm like, wow, well, your testosterone's 220. That probably has an effect on it. How's the Viagra working? It doesn't work at all. I'm like, yeah, no, never going to work at all when you have no testosterone. So low testosterone is 400 nanograms per milliliter or lower.
That's low.
400 or lower, that's low. Moderately low is 600 or lower. Mildly low is below 800. Normal is above 800 nanograms per milliliter. So,
And that's at any age?
let's say adults.
Okay.
Young men in their 20s is like BYU players or NCAA Division I football players. I see levels of 12 or 1400 testosterone levels. So when I've seen an 85-year-old not on anything, he was in St. Louis with a 1250.
Wow.
So it was amazing. 1,250 nanograms per milliliter. Is that your husband? What's he doing?
He's moving something.
Moving the lights. Okay. And,
You don't
did
recognize
that cause
him?
you stress?
He's in your house and you didn't recognize him?
I'm not looking at him. I have to look at the camera. So, the dog's she's joking. Do we need a high liquor? I'm not looking at her. Okay. So you cannot maintain a functional erection with low testosterone. Not going to happen. So you got to find out what is the cause of the low testosterone. So I see all these young guys come into my practice and say Cialis or Viagra or whatever, and no one's trying to figure out the cause of the low testosterone. So if you're not younger but older, we still need to figure out the cause or what happened. Is it pituitary? Is it vitamins? Usually vitamins. Number one cause of low testosterone, what I see. And that's caused by?
Genetics.
Genetic errors, yeah. Yeah, not genetics, genetic errors. Yeah, so these SNPs or errors I keep talking about, like MTHFR, like COMT, like all the stuff you hear about and read about online, these are really ancient. Some of these have been around for 1,000 or 1,200 generations or more. From Norway or Scandinavia or somewhere. Can you imagine? Because everyone who has C677T is related to everyone else who has C677T.
Crazy.
Yeah. It's really...
There's a lot of people with that error.
There's a whole lot. In Utah, there's millions. In Young Living Distributors, there's probably 1 million. So okay. So the number one cause of low testosterone in men is... I said it a minute ago. Did
Vitamin
you forget already? Vitamin deficiencies.
That was my answer the first time.
B12, folate, pantothenate, the ones that are usually caused by MTHFR. So the number 2 cause of low testosterone I see in men is, no one knows. It's all magical. No. Doctors think it's magical, pituitary damage or testicular trauma. Some kind of trauma.
Some kind of injury?
Some kind of injury or trauma has occurred. So back to ED. The number 2 cause of erectile dysfunction I see. Number 2. They're older guys. Anyone out there guessing, trying? Number 2 cause, plaque buildup, arterial plaque. Arterial plaque, and you can't get proper blood flow to the man's penis. So what happens is it's got to be cleared out. So now there's a new technology. You got to check it out. If this is your hubs and he doesn't have any vitamin deficiencies, his testosterone's above 800 for whatever reason, and you're happy with all that, but he still has ED, look at Gainswave. Find a urologist in your area who's using the new Gainswave technology and have a procedure done. So, because what it does, it vibrates the shaft of the penis and stuff and gets rid of the plaque.
Crazy.
So, yeah, it's really cool technology.
Never even heard of that.
Yeah, I'm going to really be suggesting it more and more as the months go by with patients. So, Gainswave is really cool. It's the future for dealing with ED. So, if you're 58 and you've had a coronary artery bypass or a heart attack or whatever, and you can't get an erection, you need Gainswave and not Viagra. You need Gainswave. You need to make sure testosterone's optimized. Do not believe those two horrible studies that have been wildly disproven that testosterone causes heart attacks. It does not. It reduces your risk for heart attacks. So, and if you're cleared by your doctor, your cardiologist, get your testosterone up to above 800. Get the Gainswave performed by a urologist. It's natural. Well, I don't know if that machine is natural, but you're not taking drugs with it. It just clears out the circulatory problems down there. So it's really cool. So what's the female version of Gainswave?
I don't know.
It's called a mommy makeover. It's vaginal rejuvenation procedure. You can Google, because our office does it. I don't do it, but my partner does it and his team. The Aesthetica Mommy Makeover Vaginal Rejuvenation, and get an idea what's going on there. We're Utah, so we're super cheap, or Google someone in your area who does it. It's for if you've had a lot of babies and stuff like that, or if you got damage down there, whatever you've got going on. It's just a really cool option. So, vaginal rejuvenation. Okay, let's talk about miscarriages. Mm-hmm. Let's talk about pregnancy first.
Can I ask any questions that came with those topics?
Yeah.
Okay, so what if testosterone is okay, but you're still having problems with ED? He said okay, so I'm assuming it's still kind of low maybe.
I don't know what okay means. It better be above 800. If it's not 800, you got to figure that out, because it could be a big difference between someone who's at 600, they may have partial ED, and someone who's 850 probably won't have any ED.
Yeah.
And or if they're 1,000, they probably definitely won't.
Yeah.
So back to, do you need Gainswave, or back to you have a vitamin deficiency, or back to, start with the basics. Do the SpectraCell first. Get your genetics tested too if you need to. Are you tired a lot? That's the first thing I'd ask. Are you fatigued? Are you tired?
Yeah.
Are you so tired and worn out by the time you get home, there's no way you can spend time with your wife because you're exhausted.
Yeah.
So, a lot of tracks and possibilities there. They've got to be very carefully dealt with. You need a really good doctor who can do that. Okay, so but yeah, for Valentine's Day, this is kind of late. I agree. Maybe it'll be like we can switch Valentine's Day to the 28th, and get things fixed between now and then. But probably more like March 28th. But yeah. So ask me more.
You mentioned earlier B12 is really good. That's like the most common deficiency you see.
Methyl B12.
Yeah. So what B12 do you recommend the most?
Methyl B12.
Just is there a certain brand?
But usually, if they have a B12 deficiency, that in my brain I'll start assuming there's a lot of other problems there. No, it's got to be methyl B12. But some people with COMTers and stuff, they need adenylyl hydroxy or a hydroxy B12.
That's my favorite. I take that every day.
Yeah, the adenylyl hydroxy cobalamin from Pure Encapsulations.
Yep, exactly.
It's really good. So you can grab some of those and try them. Mm-hmm. Or Super B.
Yep.
Which is Young Living carries. If you're a Young Living distributor, I'd be all over Super B. So I'm going to say it again. I've said it before. I'm going to say it again. The number one treatment for low libido and ED, if I was a Young Living distributor, I'd give your husband is Master Formula and Super B. And I'd probably check his genetics and a SpectraCell. But if you just want to wing it and not do those things, I don't care either way, but it's your choice. But do the Master Formula and do 2 Super B. And if he likes it, good, go with it. Give it 90 days. If he hadn't improved, then call me. Mm-hmm. So if it's a fertility issue, we're going to delve into this further here in just a minute, but probably be on it a little sooner. So if you want to see why you're 32 and have low testosterone as a female and you're dry down there and you have a lot of other issues, you can try the Master Formula and Super B2. It may deal with your problem. If it's MTHFR or some of the others, you may like it. Then again, if it doesn't work, Call us. We'll help. So I just gave you some great free pointers. Those are amazing. So, okay. So to get pregnant, that's the number one thing I'd do if I was a Young Living distributor and wanted to get pregnant. Well, you have to have a husband. Well, sorry.
You have to have a way to get pregnant.
Yeah, sorry. I don't even know how to address that anymore. A boyfriend, a live-in something. Okay, so...
significant other.
Significant other. Okay, yeah. So, yeah. So, yeah, take Master Formula and Super B. So they're great. I
What
had a
if you're
hand
not
in
Young
designing both
Living?
of
What
those.
would you take?
Oh yeah, thank you. I would take Thorn.
Is it-
2 a day. Thorn Basic 2. I think
Yeah.
it's Thorn 2. Thorn Research is a great company.
Yeah.
I take Thorn Research 2 a day and 2 of our MTHFR supports or support pluses. If you were not Young Living.
Yeah.
So for prenatals for women, I do Master Formula or Super B, 2 Super B a day. If you have bad methylation problems, you need more than just one prenatal or Master Formula. You'll need some Super Bs too. I've done this often enough. I know. If you're not Young Living, you can look at Thorn Basic Prenatal. Take that and take 2 of our MTHFR Sport Plus a day.
Mm-hmm.
You might need more. I've had patients need more.
I'm taking 4 right now, and I'm just a normal.
Right, but if you're
MTHFR
pregnant, it ramps way
You need
up.
more.
Yeah, you need a lot more. So yeah, so if that you're just So, but it's according to what you've got. So
Yeah.
let's get into So that's if you're trying to get pregnant. Those are things I would suggest you can do, or call us and we'll tell you exactly. I'll look at your SpectraCell. We'll get that. I'll look at your genetic profile. We'll figure it out. So that's what I get paid to do. So let's talk about recurrent early miscarriages, which I hear a lot about. It's usually, not always, but usually caused by low progesterone or lack of progesterone production.
And how are women low in progesterone, or why?
It could be vitamin deficiencies, most commonly. Maybe they're on the wrong kind of prenatal. So if birth control pills make you feel crazy, or you feel horrible on them, or you hate taking them, or quit taking them, you probably have some kind of MTHFR methylation problem. Probably, I'd say 99% chance you do. So you're going to need either the Thorn or the Master Formula right away. And I'd do it for at least 90 days before trying to get pregnant. So, okay, so your question was, why would they not make enough progesterone? Yeah. Well, it's all these endometriosis cases. It's all these PCOS cases we've been seeing and dealing with and helping with. It's lack of usually B12 and some other B vitamins. So it's in Master Formula and in MTHFR Sport Plus. It's in Super B. So, or they could have damaged ovaries and they can't make enough progesterone then, or they have genetic problems. So I've got probably more than 100 emails from women taking progestin plus who are like, I was able to maintain my pregnancy. I took it all the way through. Good. If you need more help than that, try that first if you're Young Living, or call us or email me or text me on Facebook or whatever. I don't know what it's called. Is it messaging? What do they do on Facebook?
Direct message.
Whatever. Yeah, do that, and I'll give you some other suggestions if you can't get Young Living Progestins Plus. But yeah, and sometimes some of you are going to need prescription progesterone, natural progesterone, to maintain that pregnancy. All of them are safe to take through the 9 months of pregnancy. So they won't suppress your own production. They'll just add to it.
Keep going.
So a woman before she's pregnant might have a 20 if she's really healthy, a level of 20 nanograms per deciliter, or 20, just remember 20 on her progesterone. On her last day of pregnancy, what could she be at?
Really
optimally?
high, really high.
How high is really high?
I feel like I'm going to either way over guess. Isn't it it's like 800 higher?
You're really close.
900?
It's 900.
I was going to say 900.
Yeah, so that's the difference between when they're not pregnant. So what are they the day after they're
Oh,
not
it
pregnant?
drops, right?
Yeah, what do you think it
Back
drops
to
to?
like 20 or back
It's
to what it would be.
zero,
Oh,
yeah.
yeah, completely.
That's why someone would get horrible postpartum depression.
Yep.
But the most common cause of postpartum depression is
Would be vitamin deficiency, right?
bingo. Yeah,
yeah.
because they took the wrong kind of prenatals
Well,
when they're
and
pregnant.
doesn't the baby deplete you of everything too?
Yeah, it sucks you dry. They're like little vampire sausages in
Little
there.
parasites.
That suck you dry. Yeah. So, little
Vampire sausages. Good to know that's what you think of babies.
How many kids do you have?
Yeah.
So much trouble. Oh, I'm a dead man.
That's funny.
Okay, but all the moms are laughing knowingly. Okay, so eclampsia and preeclampsia.
Wait, real quick.
Okay.
Got some questions regarding that.
Okay.
So prenatally wise, we need you need to find one that has a natural form of folate, not folic acid, right?
Not folic acid or not cyanocobalamin.
Yeah, because those ones that's what makes
Muy malo. Very bad.
Very bad. That was like the biggest thing people kept saying. I kept asking.
Right. So Thorne research, their basic prenatal is amazing, or master formula. Either way, you're going to have to take additional support. You're going to take, if you're not a young living, or you are, you can take MTHFR Sport Plus. If you have bad homozygous C677T and a bunch of other bad methylation errors, I'd probably dial in the Thorne research in the basic prenatal and the MTHFR support and Sport Plus. You're going to need a lot of it.
Yeah.
So we've seen that. We've seen that in our own family.
Mm-hmm.
So yeah. So
Question. Someone said, should you not be taking progesterone if you're not trying to conceive?
no.
You
What?
always want to take it, huh?
I don't know if you always want
Well,
to. You do, but
I do.
Yeah. No, not if you don't need it, don't take it. But if you need it, take it.
Yeah.
So, but if you don't know why you're taking it, you should find out.
Yeah.
So,
And then
I would rather you take Master Formula and Super B and before you try Progestins Plus, because you might be able to make your own progesterone fine.
Mm-hmm.
So, and if you don't, add Progestins Plus. So,
yeah. And then should you be cycling through your cycle with progesterone, or do you find?
I'm not a cycler.
Okay.
I don't believe in it. Sorry.
No,
I know. Good luck. As I keep hearing woman after woman, well, they tell me to cycle, but I couldn't figure out when I started my period, or when the cycle started, or what was the first day of the month, or and so they're just hit and miss. It's a disaster.
Yeah.
Don't cycle.
Just take it.
Just take it.
Cool. Go ahead. Keep going.
That's it.
I'll keep pulling questions as we go.
Okay. So eclampsia, preeclampsia, and MTHFR. If you go to PubMed and put in preeclampsia, PRE-ECLAMPISA, and then you also there's a space there, and then you put MTHFR, you'll see 124 articles come up. Why hasn't your doctor read one of those? So if you have preeclampsia, you should be asking them that. So the worst form of MTHFR seems to be the cause. C677T error, the big bad ugly. And you got to have a B12 deficiency, maybe a few others. So if you've had a history of preeclampsia, or you're worried you're going to have preeclampsia, or you've had preeclampsia and almost died, number one, you have MTHFR. You have C677T. Number two, get a SpectraCell, get your genetic profile, get the foundation methylation kit. They're on sale now for how much? 49 off, 50 off?
50 off.
50 off. Grab one of those. Start with that if you want to. But get a SpectraCell. Don't play around with this. It's deadly. And you can even do it if you're pregnant. So let's see what the results are. I would even, if I was someone that had preeclampsia before, and you think you're flying right with, you're doing the Master Formula, you're doing the 2 Super B or 4 Super B or whatever it is, or you're doing the Thorne prenatal, and you're doing 4 or 5 MTHFR Sport Plus, you feel really good. I'd still check at 4 months in your pregnancy a SpectraCell. It's not worth messing around with them because it can kill you. So really critical that you do that. So that's what I would do if I was a woman who had a history of eclampsia or preeclampsia. It's in the literature. I just found that the other day. I feel stupid that I haven't known that before, but I'm guessing about 100,000 other doctors haven't seen it before too. So,
And would you say for like women who's have their mothers went through preeclampsia or like sisters, they should do that as well because it's generally very similar?
Yeah, be all over that. Let's talk. call me. So, so that's why I think you ought to do all that. Get the foundation methylation genetics kit, get a SpectraCell, go from there. I just talked to a couple of ladies this week who had preeclampsia, eclampsia. That's when I figured it out. I'm like, oh. So, yeah, it's because they were going, what's the cause? So let's talk. Easy testing, much grief saved, and much agony and risk of death saved. So take the correct prenatal, take Master Formula or Super B for Young Living, or Thorn Research Basic Prenatal, and the MTHFR Sport or Sport Plus even. So if you have bad methylation problems, the lead up being homozygous C677T, you're going to need a lot more than just the prenatal or a couple of methylation sports. I track with testing. I would, and I'd be all over it with more MTHFR Sport Plus or Super Bs. You need to feel really good all the way through your pregnancy, not butt tired, exhausted, crawling. And if you have a history of postpartum depression, you're not taking the right kind of prenatal. So, so let me be clear about this. Super B isn't really designed for that kind of support in pregnancy. That's why Master Formula isn't either, and I don't want to get Young Living in trouble. So that's why Thorn Prenatal and our MTHFR Sport Plus are a lot more targeted towards those particular problems. So there it is. So and now questions. I've talked. My voice is hoarse.
So you're gonna keep talking. Let's see.
I know the kind of new breaking information about all this. We've all been fighting this MTHFR stuff for the last several months. You know, all these Facebook Lives and stuff. We're trying to educate everyone. Wow, really? All the ladies out there with eclampsia or preeclampsia who've lost babies who almost died.
Yeah.
Wow. Yeah.
I know, it's my own mom. And my mother-in-law went through similar things too. So someone said, in addition to taking progesterone, should you also be adding extra estrogen support in the first 14 days of like their cycle to help conceive? Doesn't really matter. And then one more time, I know you've said this like 7 times, but what is it, Master Formula and Super B for prenatal for Young Living?
That's just my Young Living. Don't ever say that. That's
but your kind of recommendation.
Yeah, I was involved with both those. You're totally fine.
Yeah. And this lady said
But you want to get a lot more targeted, just so I don't want to get Young Living ever blamed for anything. But Thorn Basic Prenatal is really excellent. It's not basic at all. It's kind of a joke that they called it that. And there's some other methylation prenatals out there, but Thorn has the best. Probably the best, most used one. I think
Now has another brand too.
No.
Is it Now?
Oh, no. Okay. No.
I saw another one.
And take our MTHFR Sport Plus. I mean, we have someone in our own family, and she was taking Thorn. She made the mistake of going off Thorn, and she crumped. So now she's back on. She knows to take Thorn and take the 3 or 4 MTHFR Sport Pluses a day.
Yeah.
She played around with it, got it perfect, felt great, had a great delivery.
Yeah. And then someone said they thought vitamins weren't good for fetuses. Do you have anything to address about that? I don't know. I just thought that was an interesting comment. I've never heard that.
Well, what? Yeah, no. I'd probably... It's old wives' tale.
Yeah.
Though there are some studies from the 80s that showed that too much B vitamins caused birth defects. There's like one study from the 80s. And they were using folic acid and cyanocobalamin and a bunch of other crap.
All the good stuff.
And it's just, it was not as poorly done study. I didn't show anything. And if your OBGYN is still stuck back in the 80s on that one, I'd probably be looking elsewhere. So that's just crazy. No, that's long since disproven. Again, go to PubMed, PubMed, Google it. And then go search preeclampsia, MTHFR, and you tell me if vitamins are bad for babies. No, that's crazy.
Yeah. What would you recommend? I know you haven't talked about PCOS quite yet. I don't know if you
go ahead.
Okay. What would you recommend for those of us with PCOS who don't ovulate on their own? She's been trying to get pregnant for 1.5 years with no luck.
Spectre cell methylation foundation gate. You'll find out what's going on. You'll know why you're not getting pregnant.
Yeah.
Spectre cell will be like boom,
Very.
and then 90 to 180 days later, it's going to be as optimal as it's going to get. If you're going to be able to get pregnant, it should be by then. So
Makes sense.
it's just those two basic things, and maybe lots of natural progesterone, and get your thyroid checked too.
And what are the natural progesterone options?
Well, I'm not going to say it on here.
But like compounded, because someone was mentioning shots. Is that a thing?
A lot of the OBGYNs do progesterone oil shots. I don't know why they do that.
Okay.
I know it's because that's what they were taught in residencies from the 1950s.
Let's inject some stuff in you.
Yeah, every day you get a big shot of progesterone. So I'd probably look at sublingual RD, rapid dissolved tertiary. Get my book on progesterone. It'll say enough. If you have questions, message me. Is it messaging me on Facebook? And I'll tell you some other options that are out there if you're not a Young Living distributor.
And then what kind of progesterone is to keep taking when you're pregnant? Is that a thing? I saw some kind of question like
Yeah.
Is there
Natural.
There's any natural kind?
Natural.
Okay. Always natural.
Not the synthetic.
Come on. Any advice with PCOS and thyroid issues? Is it same
They all
kind
have
of thing?
thyroid issues.
They all do.
All PCOS patients have thyroid issues. Do you know someone at this table who had thyroid issues?
Myself.
And what was it caused?
Mine was my MTHFR. And it's resolved, you guys. Let me tell you. I had the
That's
coldest
the crowd
hands and feet.
roaring in the background because it resolves with the proper vitamins.
And I didn't even take thyroid medication.
If you have a B12 or zinc deficiency or selenium deficiency, you can't make thyroid.
That was me like 5 years ago.
You can't make thyroid.
It's been a process, but I am thumbs up.
You won't make T4, which becomes T3, which becomes T2, which becomes T1. You won't make T4. And you'll be like, why can't I make T4, doctor? And the doctor go, I don't know, it's hypothyroidism. Take this. Drill a little deeper. Find out why you're hypothyroid. Good grief. Quit taking thyroid hormone if it's really MTHFR or some other vitamin deficiency.
Yeah.
So I check that all the time. I see it all the time. It's like diabetes when you have a chromium or zinc deficiency, really, or B12. Google B12 and insulin receptor. Google those 3 words, B12 insulin receptor. There's all kinds of studies that show that B12 deficiency or even a thiamine or riboflavin deficiency, but especially B12, your insulin receptor will not work correctly.
Wow.
So you appear to be diabetic when in reality it's a B12 deficiency.
Crazy.
So
That's amazing. This lady, she said she's had nonstop bleeding for months, specifically 8 months plus, she said. It stops when she takes birth control. She's trying to conceive. Do you have any suggestions on how to get a regular cycle? Too complicated?
why is she bleeding?
Because she's on probably endometriosis? No.
She's on endometriosis.
No,
Is that
I'm
like a
saying-
drug?
I was going to say she's on birth control. That's probably affecting it too in the downtime.
No, she needs to talk to me. She needs to call.
Okay.
So yeah, because it's probably you're going to need progesterone to begin with. We need to find out why you're bleeding. Is it a vitamin deficiency? Is it ovarian trauma? Why are you not producing enough progesterone to shut down your cycle? So, does that make sense? It should make sense to all you women out there because right before your bleeding starts every month, you have a big spike of progesterone. Some of you can't because of genetic issues or ovarian trauma or whatever. So.
Tell them what you
Is the
said.
dog playing ping pong?
She's having fun in her cage tonight.
We can't hear too much on here. So
Okay, cool. We can hear her.
It's like ping pong.
I was amazed. You told me a couple Facebook Lives ago that, like, birth control isn't actually giving you, or what was it? Instead of giving you an actual period, it's just making you hemorrhage.
Yeah.
That's terrifying to
There's
me.
no period there. That's a hemorrhage, and that's a hemorrhage event.
It's
It's
terrifying.
like you're gonna flow free, little bird, for a week.
Flow
and,
free little bird. Okay, what supplements do you find best boost fertility?
I think we covered that, didn't we? Okay. Super B and Master Formula if you're Young Living. I have probably 70% of my audience is Young Living. maybe higher some nights. So Super B Master Formula, best thing ever for fertility. I did not say PD 8020. I did not say Endogize. I did not say Progestins Plus. I said Super B and Master Formula, didn't I? Was I clear?
There you
Okay.
go.
If you're not young living, it could be Thorn Basic or Thorn 2 a day. I love that. Or if you have fibromyalgia, Thorn multivitamin 3, Roman numeral 3, no copper, no iron.
Mm-hmm.
If and you need to probably add MTHFR Sport or Sport Plus. If you have methylation problems, same with Super B. Add it if you have methylation problems. Figure it out, spend a little money, figure it out. So get it under control.
Yeah. What should you take when you don't have a thyroid but you want to support it still?
It's gone. It's been buried in a little somewhere.
Well, what do they do with it when they remove it?
They incinerate it in the hospital incinerator. That's the law. You can't keep it. Only weird doctors who end up in prison keep those
I
parts.
asked to keep my extra bone when I got it removed, and they wouldn't let me.
No, no.
Hey, I was
It's
born
like
with it.
monkeys
It
and
was
the other
mine,
critters do that.
and then it was gone.
Dogs like to keep extra bones around. Even so. What?
I'm sorry, my brain went on a
Yeah,
weird
you
track.
just really got me off.
I was wondering.
Just get on with the next question. Don't go there ever again.
Come on. Why would you not want to take Endogize?
I don't know. Well, if you're trying to get pregnant and stuff, I'm trying to deal with the root cause, do it as cheaply as possible, deal with it appropriately and correctly. And I'm just saying, I don't want anything covering up the real problem. Energize does a really good job helping glands and everything work and balancing your hormones. Why do you need to balance your hormones unless you are damaged or have a vitamin deficiency? If you're damaged, yeah, you do the Energize. But if you're not and it's a vitamin deficiency, deal with that. So Energize is really a great product, but it's got a special place and need for it. You don't slather it on everything, including all the kids and yourself. Yeah, because it's pretty powerful stuff. So be careful with it.
Always be careful.
Start low, go slow.
That's your catchphrase, huh?
Yeah.
I'm just reading. This is kind of a random
Just
one.
ask me everything.
Okay. They're wondering if glutathione would be a good support for gout.
I would assume not, but it's worth a try.
Always worth a try.
Because it dramatically, so hugely reduces inflammation. So that's what the NIH says. That's what everyone says. And we know from our own studies it does.
So this is just kind of an interesting comment. So she had preeclampsia with her daughter, and now her daughter's 26 and has PCOS. Do you think that's a connection at all, or is that
I think I've been preaching that for months now. Mom had MTHFR, C6, 7, 7.
So now daughter has
MTHFR, C6, 7, 7T. Yeah, so they both have the same thing. So if the daughter ever gets pregnant, she's at risk for preeclampsia, but hopefully it's all dealt with up front because I tell everyone how to get rid of their PCOS.
What's the best test to find the vitamins you're deficient in?
SpectraCell. Do not do serum levels, waste of money, time. SpectraCell looks at intracellular levels. We use it in research. It's a great test. Call my office. We'll send you one.
Or you can order online at danpursermd.com.
Yep. That's me. Dan Purser.
So this woman, she had her thyroid removed due to cancer, but also has PCOS. And would you recommend only treating the PCOS since the thyroid's gone, or what do you kind of...
No, treat it all. Treat the thyroid appropriately. And a lot of those patients have thyroid resistance. That's a whole other issue, which your doctors may or may not understand. Most don't. And treat the methylation problems. Treat the PCOS.
Makes sense.
But she should get a Pro7 genetic kit. I want to know why she had thyroid cancer. Does she have FOX1? FOX1 on the Pro7, if it's homozygous, bad for thyroid cancer.
Risk. Wow.
Yeah.
Interesting. What would be the appropriate dosage of prometrium for someone with PCOS and endometriosis that came off birth control 6 months ago and has not had a period?
Is she happy?
I'll keep reading. This is the rest of her comment. My doctor is adamant I take 100 mgs for 7 days to induce period, then after period start taking 100 mgs daily to see them back in 3 months. So I guess she didn't say she's happy.
I don't know. I've never used a dose that small. With a young person of mine, especially someone with endometriosis,
heavy.
and PCOS, yeah, I'd probably go the 200 milligram capsules. Sorry. 200 milligram capsules, 4 or 5 of those a night.
Yeah. Will taking it daily without stopping regulate her period and ovulation? That's
It'll
the
shut
goal?
down her pain and inflammation, cure her PCOS, then she can back it down slowly and play around with what amount allows her to have a period. You know, we've done that in our family. So,
Right here.
yeah. But it gets rid of the inflammation and the pain and
Totally.
the bleeding.
He says I should have endometriosis, but I don't.
He said,
You. Oh, I'm talking about myself. Sorry.
what?
You said I should have endometriosis, but I
Oh,
don't
yeah.
because we're addressing it.
Yeah, I've never had endometriosis.
You have endometriosis.
Endometriosis of the mouth, maybe, because I say stupid things sometimes.
So someone said they're in a different state. How do they get a consult with you?
Set up online. We'll talk. If it's vitamins, all that, we can do it over the phone. If I need to prescribe something, we'll talk more. I'll explain that situation.
But he's got video chat options. He's got phone call options.
You're talking about me or the patient?
You.
Okay.
Both.
Say Dr. Purser has.
He. No, I'm just kidding. Dr. Purser has
There's
lots
a lot
of
he's
different
watching.
options.
Yeah. Yeah, we can do video chat. We can do go to meeting. We can do all kinds of things.
And then you get to see his cute little face.
Yeah, cute little face. Grumpy doctor guy.
Don't make him cry.
Dreaming about Disney World all the time or Disneyland.
Oh, someone said they were at Disney World taking notes. Watching.
In Disney Springs
In
watching.
Disney Springs, sorry.
Really? Where?
It-
Text us. Message.
Oh, she gets a free book.
Okay.
I'll message you.
Okay.
Apparently, we're giving free books away to anyone who goes to Disney World.
No, no.
What?
Just that one random person. I give away enough free books as it is.
I know, I'm teasing you. Will Master Formula and Super B help with low testosterone? It was a woman asking that, so I don't know.
It could, yeah.
In men and women?
Yeah. Yes, sorry. Yes, ma'am.
Very interesting.
Sure could. Yeah, because here goes the quote again. Good nutrition in equals good hormones out. Good vitamins in equals good testosterone out. Good hormones out, yeah. So not always, but most of the time for people that are young living distributors, we know from when we designed Master Formula that because we use Spectra cells, I had 4,000 Spectra cell results on young living distributors. And we randomly pulled out 1,000. You guys remember that. Mm-hmm. We went through them all and whited out the names and then turned them over to R&D, the identifiers as they call them, for privacy purposes. We copied them so there's no way it could just flake off and they could see what it is. Not that they cared, but and then we looked at the numbers. 85% of people I thought had MTHFR from what I could tell.
So crazy.
It was crazy, but it explains why young living distributors go for natural products because they can't break down. They can't break down folic acid and cyanocobalamin. You're not going to break down birth control pills. You're not going to break down cardiovascular meds. You're not going to break down statins. You're not going to break down hardly anything, and that's so true. You can't methylate properly. You can't break them down properly. Can't detox off drugs, even prescription medications.
Yeah.
That's who you folks are. So that's why I'm involved with you. So.
It's awesome. This is kind of a random one, but they're wondering what they can take for anxiety.
Pro 7 kit, so I can figure out why you have anxiety. You could try Super Bees. You could try thinking of all kinds of options here. I just need to see your Pro 7.
Let me pose you a question. What's the number one cause of anxiety that you see?
That's a good one.
You're You're supposed to say vitamin deficiencies.
It's not.
Dang
Okay.
it.
ATG16L1 genetic error. Or GAD1. It's ATG16L1 leads the pack. Most common cause I see, and because I get a lot of like BYU students or University of Utah students or UVU students, moms, dads, parents bring them in. They'll come up from California, Arizona, wherever, or Logan or somewhere, and they'll bring their child in from college and go, he's so anxious or she's so anxious he will not leave this, like she won't leave her room. She's scared to death. She has social anxiety, and she cries a lot, and she's really having anxiety. She can't even take her tests. We're spending a ton of money doing this. Can, college and everything is not working. Can you help us? Or I get them kids who returned early from their missions. I see that a lot too. For anyone who's LDS out there, not a lot of kids, but occasionally I see them. Parents bring them in, or the missionary training center sends them over. And it's usually genetic issues. ATG16L1 or GAD1. Look them up. Google them. So, and how you treat them. That's the most common cause of anxiety, I see.
Interesting. So this lady, she says, I probably have MTHFR. She's never been tested, but she takes Master Formula every other day because she's retired and trying to save money.
Got it.
Is the good doctor going to recommend that I take it every day, or is that adequate?
I think if you've been on it for a while, taking it every other day or 3 days a week is adequate.
Cool.
I think, there's no reason to have yellow urine, orange urine. If you've been on a long while, you can go to every other day.
Yeah. This lady said she had PCOS, started her protocol, and it was completely reversed. However, now she has low testosterone, and she used to have high testosterone. Should she back off a certain vitamin or increase a different one?
No.
She did a SpectraCell in November.
No, be the patient. And it takes somewhere around 6 months to 18 months before your ovaries and everything kind of
Kick into gear the right
kick
way.
into gear the right way, yeah. Testicles too. So, yeah, the people, this isn't going to work overnight.
Mm-hmm.
So it's essentially she's been on it 2 months, maybe 3 months.
Yeah.
If we did the SpectraCell, we probably got it back in December and 2 months. Yeah,
Yep.
It's hardly any time.
That's a great time to reverse your PCOS, though.
I've seen that 100,
Man.
more than 100 times. So
Yeah. This lady says she has Hashimoto's and PCOS. She's wondering if going plant-based is a good idea. She's currently paleo, and has been for 9 years.
I would not go plant-based if I had PCOS because you probably have MTHFR and you get most of your B vitamins from meat. Sorry. Or take vitamins and go plant-based, but make darn sure you know your genetic errors in your SpectraCell before you do that. And check a SpectraCell regularly, like every year or 18 months.
Mm-hmm.
I would, because I get people that are vegan or vegetarian who have become a mess.
They're like scurvy patients.
They're worse.
Yeah.
They're exhausted, fatigued, low hormones, falling apart, losing weight. It's not good.
They don't have anything to
Yeah, and
absorb.
if you don't have MTHFR or other methylation problems, vegan or vegetarian works great.
Mm-hmm. I remember when we all went vegan for like a week when I was in high school. That was the worst week of my
Sorry,
life.
I tried to kill everyone.
He literally did. We were all dying, and no wonder we all had this methylation issue.
Yeah.
That was horrible.
Now everyone could easily go vegan.
Yeah.
Let's do it. We
I actually
can chant.
don't eat a lot of red meat
We
anymore.
can do the vegan chant, all of them.
Vegan, vegan. Do you take insurance?
No.
I know the answer.
for like 20 years.
Yeah, he's been in cash only practice for quite a while.
They would not pay me for anything I do. I'd end up be going, I got $3 today in insurance payments. That's great. No.
He takes HSA cards though.
I take him and run to Vegas. No, I'm kidding. I don't do that.
Oh wow.
I'm joking. No, yeah. Why are we answering these?
It's a question. So this lady, she has MTHFR, and when she was pregnant, she took 200 mgs of Prometrium, and it greatly helped her daily headaches and migraines. And she's wondering if taking Progestins Plus will help with the same effect.
I have no idea. Try it.
Yeah. And
Why does she need all that progesterone? If she has MTHFR, she's not treating it properly. Probably.
yeah. Do things like Lyme's disease cause vitamin deficiencies?
No. I believe vitamin deficiencies can set you up to get Lyme disease, though, because your immune system gets suppressed. And the Spectracell, they have an Immunidex number and a Spectrox number. That's the antioxidant and your immune system functionality number. And if you have bad deficiencies, you're going to have bad immune system function.
Yeah. This is a good question because I just figured this out myself. Okay. They said, what's a good alternative for someone who has trouble swallowing? They said Super B tablets, but I'm just going to say in general, I have the best tip for swallowing pills because I'm the kind of person who gags on my pills every morning. And my sister...
Go ahead and just say it.
Okay,
Do the tip.
okay, fine. What you have to do is you put the pills in your mouth, put the water in your mouth, literally tilt your chin down to your chest and swallow. You think it's counterintuitive, but it really helps so much. Like, I take 4 pills at the same time, and I can swallow no problem, and, like, no gagging, no troubles. And I'm the kind of person who cries every morning taking my pills, and I don't. Not anymore. So there's my tip.
wife just told me about that trick.
I know.
Did you get it from her?
No. My Bailey, one of her other daughters, one of my sisters, gave us that. It's a good tip. There you go, guys.
Okay, there it is. Your chin down, swallow. Put the pills in the mouth, water in the mouth. Put your chin down, swallow them, and then have someone there in case you need Heimlich. Okay.
It really works, you know. Okay. Let's see.
You got a lot of likes on that. That's a good tip.
I'm telling you guys, it works, and I'm Someone's like, love the eye roll because you're rolling at me. Where to start with 4 miscarriages and no live babies? That's just a sad. Do you just want to do your basic overview?
Spectracell, methylation testing. What the heck is going on? Let's start there.
Yeah.
And check your progesterone level while we're at it. And probably those 3 things. Make sure your thyroid's okay. You get some hormonal metrics in. So check your thyroid, your progesterone, maybe a testosterone level, and then maybe a DHA to kind of get an idea where your adrenals are.
Yeah.
Something's not right somewhere. A lot of something. And are you tired all the time? Bet you're going, I am tired. Yeah.
This lady, she has Hashimoto's, fibromyalgia. She's never been tested but suspects MTHFR. She's a hot mess. She's been trying to conceive for 6 years with no success. All testing at fertility clinics shows nothing's wrong. I'm putting quotations around that because you never know.
I know, I see them all the time.
Obviously, that's not true. What are your thoughts?
Well, do what I suggested, get a Spectracell, set up some time with me, get a methylation foundation test. You may want to get the Pro 7. Yeah, it probably would. A Spectracell does come with a ball. If you get a Pro 7 and a Spectracell, you and I can talk. We'll talk for 30 minutes. Anyone who gets that combination, I'll talk to you for 30 minutes for free. Good grief. You're a mess. You'll be a hot mess if you're getting those tests. So yeah, throw that on the page now. I guess that's a new thing we're doing.
What?
30 minutes for if they get a Spectracell.
It's 15 minutes.
No, listen.
Wait, okay, sorry.
Yeah.
I wasn't listening. Ha ha ha.
A Spectracell and a Pro 7. You can have 30 minutes of my time, certainly. And I'll probably talk to you more than that.
When you buy both tests together.
Okay, good deal.
So, because you're probably a hot mess to get those tests. So, you also need to go to End Fibromyalgia with Natural Options, the Facebook page, whoever the strange lady is that has
She's
had
not
all
strange. She's listening to you.
Okay, yeah. Oh, sorry, this lady. Well, I don't know. She's
I'm
strange to me. I don't know her name. Don't give me her name. You have her first name?
I don't know where that comment went.
Okay, Ethel. So
that's a compliment when he calls you Ethel. Let me tell you.
So let's figure this out and get you better. Get you past your fibromyalgia too.
Yeah.
And then you can conquer the world. So get off the high copper foods.
That's the first
thing. Oh, you're going to love it when I say that. That'll cause a riot.
Goodbye avocados.
And almonds.
And everything.
Yeah, sorry.
Okay, so this lady, she got her blood test done, and her progesterone came out extremely low or very low. How does she increase it? How does she increase it?
Why is it low?
vitamin deficiency.
You're guessing. She's guessing. She doesn't know.
part
She
of my
can take
job.
progesterone. Nowadays, if she's young, I'd be going, wait, what else is low? Let me look at all your hormones. And wow, they're all low. You have a vitamin deficiency problem. So you have you have some kind of genetic problem blocking your ability to absorb vitamins. So, and I dig right in and find them. Best money you'll ever spend to find that out. Because it ends the problem. You know it forever. You got genetic errors. Here's what you take to go around them and have a party. Get on with your life. Call me if you need me at that point.
This lady said most doctors say she's premenopausal, and want to put her on birth control. Is there something I can take to have children / reverse the premenopause? She also has Hashimoto's. Don't know her age.
So she's probably young. So she's not 70. I'll tell you that.
No.
So low vitamin, poor nutrition in or lack of vitamins getting in equals poor hormones out, and you appear to be premenopausal when you're 32 or 28 or 37 or 41 or 43. It's lack of key hormones caused by lack of key vitamins, caused by genetic errors that block your ability for your cells to absorb vitamins. Like those hand signals.
Very good.
Blocking vitamins from being absorbed into the
Whoops.
cell. C.
I hit my microphone trying to do those.
C
with
for
you.
cell.
That's great. That's a cheer. You should make a cheer.
We could get the N-Fibro group to put a cheer together.
Okay.
For you.
Oh, they
They'd love
will.
to do that.
They would.
Oh, aren't we doing in October next year a Saturday at Disney World or something?
Oh yeah, we were kind of thinking October.
For fibromyalgists,
Crawl.
those who the fibromyalgia crawl.
I like that name, but I know it's a negative
That's
connotation.
negative.
I love it. The
For
fibro
everyone
crawl.
who's gotten all their fibromyalgia symptoms under control on the In Fibromyalgia with Natural Options page, we're thinking about October of next year. So start saving your pennies.
I thought this year.
This year. Yeah, sorry, this year. Yeah. Start saving your pennies. It's 8 months away, and it's coming.
8 months away. Holy
Yeah.
cow.
So get past your fibro, and if we have 1,000, that'd be great. We'll march through that gate. we all have In Fibromyalgia with Natural
Stampede
Options
through the
shirts
park.
on. Yeah, and I'll have a little orange flag. I'll lead the way or something. Okay,
This one's
sorry.
kind of off topic, but I know you might know the answer to this. Her husband has daily cluster headaches and severe cramping of his hands, arms, and legs. All tests come back normal. What do you think's
Because
going on?
they haven't done a spectral result, I'll tell you that. It's probably a magnesium deficiency,
I
a really
knew it.
severe one. Get him on magnesium chelate. Doctor's Best has I can't remember what theirs is, but they have a magnesium chelate. I take 3 a day for a while and see if it goes away. If it doesn't, call me. We'll do a spectral cell. We'll figure it out. It's a vitamin deficiency.
So this woman said, my testosterone's chronically low. What can I do to help it?
I think I've pretty well laid that out today.
Gotta answer again.
Yeah, vitamin deficiencies. Check it out. Or you've got ovarian damage. If you're 63, we should probably figure it's menopause. But we don't know your age, and I'm guessing you're like probably 38 or something. Yeah, try the Master Formula. Master Formula Super Bees. If it doesn't get better in 90 days, let's do a spectral cell.
Yep.
Is all this helping? Are they liking this? Or am I
Yeah.
boring everyone to death? I can't tell. I don't get any feedback. Except for you.
You don't get any feedback. That's part of
randomly
the
asking
job.
me weird questions.
If someone gets the foundation methylation, you'll read the results, but they have to set up an appointment.
Right.
And right now, what we kind of switched to is half-hour initial appointments because we've just found you guys don't need a full hour a lot of the time.
4 hours, yeah.
It's a long time. And so we're doing that for $250 for half an hour initial. That's a great way to get started with Dr. Purser. You can do that in office, phone call, or teleconference. So,
Yeah, it's fun.
but like he
Well,
said
fair enough.
earlier, he just made this new deal. If you get a Spectre Cell and a Pro 7, you'll get a half-hour follow-up. That's a crazy deal. He's never done that.
Free. How do I do a cheer for free? Free.
F-R-E-E. F-R.
Okay.
Oh, the lady with the low testosterone was 26.
Wow.
She had a crying emoji. That's sad.
Wow. Yeah, no way, Jose. I mean, no way. Wow. Yeah, she needs Spectracell and methylation, foundation methylation. Can't figure it out.
People said they're never bored listening to you, but I don't agree with that.
I know you guys get bored and correct me all the time. Treat me like I'm an elderly, decrepit, old dude who, yeah, okay.
No, I'm just teasing.
Whatever.
You're always fun to listen to.
Yeah.
If all PCOS patients have thyroid issues, what testing do you need and where should your levels be? Doctors only want to test TSH and say that's fine.
Always, always, always you can go to Stop the Thyroid Madness. You can go to all these other thyroid support websites. Always, always, always get a TSH, a free T3, and a free T4. The magic number is a free T3.
And what
you
should
may
it
not
be?
be converting. It should be around 4. You cannot, if your T4 is good and your free T3, your free T4 is good and your free, I'm saying FRE, free T3 is bad, you're not properly converting T4 to T3. That's why you get all that. Or they both may be horrible. Or I saw 1.4 free T3 earlier this week. The woman was nearly dead. She was really in agony. Just having a horrible time. 2.0 is really bad. 2.5 is horrible. So, but below 2 is nasty. It's just bull. So, yeah. So get a free T3. You can go to on my website, danpursermd.com, go to testing and look under direct labs. Click on it and get the test. If your doctor won't do it, go do it. They're cheap. They're through direct labs. You pay cash or you pay with a credit card, and they'll say, yeah, we have a draw site down the street from you. They have 1,300 draw sites nationwide. Go get it done. You'll know. I just told you what the value should be.
And do you recommend people get testing done first and then talk with you, or
Helps.
Or should they talk to you first and then get testing?
If they don't have the right testing, I usually just say, let's reschedule this. Get this testing. Go grab it or get it from your doctor. It's what you need. Let's talk when we have all that. So
generally start with testing.
I'm pretty fair about all that. It's not, what I do is not perfect. What you do is not perfect. I'm just trying to get you the care you need.
Yep.
So any doctor who thinks it should all be perfect, he's going to have a perfect day. We've had one perfect day in 4 years, so not going to happen usually.
What B vitamins do you recommend the most again?
What?
Oh, like what B vitamins? So like B12.
B12, folate, pantothenate, choline, choline,
And what brands?
B6, B3, all of them. Oh, what brands? I don't know. I like Gangland Super B. I helped design it.
MTHFR support.
MTHFR support or Sport Plus. Thorne Research has a B complex that's beyond superb. Thorne Research, you can get it on Amazon, stuff like that.
Cool. That's great.
So is this just a rumor, or does our MTHFR support come back on? We'll be back on Amazon soon.
Just a
Soon.
rumor.
Wait.
I'm teasing.
No, it'll be back up on Amazon hopefully within these next couple weeks. We're anticipating.
Brad's all over that.
Yeah.
Do you know who Brad is?
No, I have no idea.
When are we going to do a face reveal of all the rest of us behind the
Never.
camera?
Never.
All right.
They'll be horrified.
Hey, excuse you.
They're already horrified enough by me, so they're like, I can't believe I listen to this goob every other week.
Actually, I think there's an About Us page on Dan Purser
Don't
MD.
tell them that.
There's our picture. We're all in there.
You can see
Am
who
I in
we
there?
are.
No, we
We took you out.
actually.
You're not a part of the Dan Purser MD team. Sorry.
I do have a son. Their brother is going to medical school soon. It's really a stepson, but he's getting ready to leave for medical school. And one day he'll be on there, and I will be gone. I'm pretty sure. I'm pretty sure they have plans now. They're thinking about exiting me out the side door. Right? One morning I'll be gone. I'll wake up.
We'll
and
give you 30 more years, and then we'll bring him in.
I'll be dead.
Yeah, that's the idea.
Oh.
The sad side. Why don't you just do a final wrap up because we're cutting. It's 8:10.
Oh, okay. Sorry, I went over. I love all you guys. If you have infertility issues, ED, pregnancy, can't get pregnant issues, stuff like that, don't go get IVF right off the bat. It's like automatic. Y'all run and get IVF. In Utah, it's cheap. It's about $12,000. In Nevada, it's $25,000. In California, it's $36,000 to $50,000.
There's better options.
Wow. And you could spend $1,000 really get a Pro 7 and I wouldn't even advise that. I'd get the methylation kit if it's an infertility issue and the SpectraCell you're looking at maybe $900. And I get so many IVF failures. Really? Or maybe you just can't make enough progesterone for whatever reason. You just need a progesterone script. Super easy and I've got, like I said, over 100 emails from either Young Living people or other people who've tried various forms of natural progesterone and gotten pregnant. So there's just so many cheaper options. IVF should be for just those who really, really, really need it. Make sure you don't have any B12, folate, pentathlete, any other weird deficiencies that you will not get pregnant if you have those. If you do, it'll be a tiny miscarriage. You'll never know it. So it'll be like a heavy period. So so think before you do all this. So anyway, it can save you some money. I know you're going to have to spend some to save some, but that's what I do. So this is Dr. Dan Purser. I love you all. God bless and go in good health.